Well, greetings to you all. This is Joseph from Heart Sound Recorder. I'd like to welcome you to the Adjuvant Protocols for Healing webinar today, getting to the heart of the matter and knowing the primary findings of the Heart Sound Recorder. Now, even if you don't have a Heart Sound Recorder, you can still learn a lot from these. And of course, I don't record my other lectures on the Heart Sound Recorder. So this is important that we're getting this on our Zoom webinars. Of course, this is my book through Saline River Press. And Lynn has just done a beautiful job, Lynn Mayer, my colleague from Colorado Springs, on updating my YouTube channel. All the notes are there now, all 54 lectures with the recordings. And there should not be any issues now. You can let us know if there are. We had a lot of issues and a lot weren't on there, but Lynn is wonderfully taking care of this for us and for me, but for all of you to benefit. And just youtube.com, Joseph Antel, or you can use this link. Now, last month we looked at the beginning of the nutritional findings. We talked about heart disease. I'm just going to skim through these slides and get to where we left off. And of course, the Heart Sound Recorder came into being early on. Really in the 1930s, Dr. Lee realized that he had to have some way to show nutritional results before and after findings. Are people actually responding to these supplements in these formulations that he was creating? And that's where the endocardiograph came in, but this is the technology now that has been reverse engineered and brought into the 21st century. And so his experience over these 30 years certainly led him to creating this technology and then the supplements based on that. Because of this, there is nothing in the body so responsive to nutritional therapy as that which is reflected in the heart. And really, that's the intent, and that is where we still continue today, 1,000 Heart Sound Recorders across the US. So these are the placement for the graphs and the alternative placements if you're having difficulty with the typical placement. And understanding that the Heart Sound Recorder, that the microphone is not a microphone, it's a sensor. It's picking up movement of the closure of the valves of the heart beyond what the ears can hear. And so understanding the Heart Sound Recorder, as we looked at last week in relationship to the graphs, is knowing what the normal graph is. And so as I scroll through here, if you were on, you remembered that really the simple way of reading these graphs is understanding 2-to-1. That ratio is the ratio that stands true throughout all of the reading of these graphs. It's that simple. And we looked at primarily last month the autonomic nervous system and its relationship with the heart and how the heart reflects. If a person is too slow, what should you use? If a person is too fast, what should you use? And the implication of these products. Phosphorus and phosphorus-bearing formulations like soybean lecithin. Phosphate liquid is the primary soybean lecithin. Circuplex is another one that we didn't discuss. And the outcome. Always we want to see the outcome. We apply the nutrition based on these principles, these truths, and then we run the graph. Does it work or doesn't it? And so you can see this. And other products, such as organically bound minerals, Cataplex G, Cataplex E2, and Orchex, which is very similar to Cataplex E2. Now, it's because when you look at the autonomic nervous system, the brain can override the normal rhythms and pulsations and function of the heart. The brain can take control, particularly the hypothalamus and the pituitary, for various reasons. So these are the products on the side of the nutritional spectrum that calms the fast heart. It also calms other things too. And I don't have a slide for this, but I just want to read, I want to take one product of these 3 or 4, if you're including Orchex, because Cataplex E2 and Orchex are very similar in their makeup, in their formulation, a little bit broader spectrum of application with the Orchex than E2. But just let's just take one of these for a moment as we review. Here's Cataplex E2. Well, what did Lee say? Now, most of you know that this is for increasing oxygen. This is the high altitude supplement. It's well used here in Colorado and other places that are above sea level. And it was known as natural nitroglycerin to relax and open the vascular structure. But here's what else Dr. Lee said. That remember, when you use these formulas, and I went through G, which is now called Cataplex B2, E2, organically bound minerals, Orchex for relaxation. As an example, these formulations cover a much broader area than we talk about when we're just speaking about heart function. So here are some other things. What did Lee write about? And this is out of his book, the Index of Products Bulletin. He talked about angina pectoris, chest pain, usually radiating down the left arm, brought on by exertion. Okay. What other things did he say that E2 could be used for? Indigestion symptoms, nervous type associated with nervous tension and cramps and spasms. I'm sure most of you didn't even think of that, which is fine. That's why we have these gatherings, these webinars, is to remind each other. And I'm reminded because I have to teach it to you. Hypertension, where transitory elevations are brought about by mental instability or environment, not even a physiological reason, but environmental and mental reasons. That's how you use E2. Now, we haven't thought of it that way. You mean when I get upset, should I keep E2 around? Yes. Cardiac neurosis, symptoms associated with the heart where primarily nervousness is the problem. Well, if I start having a conversation, this is just a quote, if I start having a conversation and I talk about this person, my heart starts beating out of my chest. This is where you'd use E2. Neurological integrity as occurring in biliary stasis, colitis, diarrhea, asthma, insomnia, pleurisy. So just one example out of this book, the Products Bulletin, where you can look and see what else was Lee thinking about for these products. And so, as I say, we looked into G, we looked at E2 and Orchex, its sister product, and how the 1,000 trillion nerve synapses can function normally throughout the body. And of course, my beloved organically bound minerals, which is the range of calming alkaline ash minerals, which really has every mineral on this planet in its formulation. So now let's go on to today to really look at the next section of clinical findings from 1930s on to today, with thousands and thousands of graphs run. Maybe even more than thousands, maybe millions. If you take the work that was done with practitioners using the endocardiograph and now the heart sound recorder, I'm sure. And the main thing you want to look at is the S1, the lub. Remember, the heart should be lub-dub, not lub-dub. And in that rhythm, lub-dub, rest. Lub-dub, rest. Twice as long it rests as it works. So if you get a graph, and then remember that as I teach you, these are all real people. None of these graphs are written up or drawn up. These are all people that I have tested over since 2012, when I began this journey with John Reichart and Mark Anderson, Tim Bayan, and others, Daryl Prusner, on this journey. This team of people that really wanted to bring this to you and the findings. And so look at this S1. This is now in the mitral and the tricuspid, because that's where the sensor microphone is over. It's in that vicinity. And so that's what we're studying. That's what we're observing. And the main thing to remember about this is 3 peaks. So if you hold up your middle finger, your ring finger, and your index finger in front of your face, that's how the S1 should look. And on either side of those 3 peaks, it's okay to have maybe one more little peak, like here, or 2, but you don't want too many. The right side should be pretty clear, and the left side should be completely clear. So that means something if something is indicated there. This is pretty much the most perfect S1 that I've seen. And because there's no regurgitation, there's no presystolic indicators here. Now look at someone that, this gentleman that I worked with for years, and he is still alive and he's better. Look at the S1 here. Look at the duration of the closure. The heart should be so efficient that it closes crisply. I think Mark uses the example of a Mercedes door, or my Acura, the door. When it closes, and that's how the heart should be. Not taking forever to close that valve. And here's the indicator. Look at the duration here. This is a very weak muscle, which we'll talk about this when we get to the end of the discussion on cardiotrophin here this morning. And look at the second sound to the first. This is boom, 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 boom. the work cycle of the heart collapses. And there's a reason for that, because the heart has become so stretched out, they call it enlargement, that it can no longer function normally. It can no longer have a normal work cycle. Boom, boom. This is boom, boom. And the key product for that, not only this high second sound in the mitral and tricuspid, but the quality that's in the S2, the height of the S2, and the quality of the S1, the three peaks. The key product for that is cardiotrophin. Now you could say, well, Joe, what about calcium? What about F? Well, we're going to look at that today. What about the B core? We'll look at that. But it's important that all of you understand that in my clinical experience and years, everyone over 50 should be on cardiotrophin. How long? Rest of their life, even if they take 4 a day. And I'll show you some graphs here that I gave someone 4, actually 3 different people. And so here you see that again in this, again, the weakness here in the S1 and the high second sound in the S2. Now, this can also mean other things. This can also mean that they may need some vitamin E in some form, E2, E, wheat germ oil. But our focus today is to talk about cardiotrophin, at least in this portion of the webinar. It could be also mean that they're not getting enough oxygen to the heart or not holding the oxygen in the heart muscle long enough. So just an added comment. And so this is a before and after, though I have better ones. Now look at this case, and you can see that if you look at the S1s, now this one obviously is turned up more, but even if you just look at this one, it's very similar in height of gain or volume than this before taking the cardiotrophin. But the main thing to look at is the first sound higher than the second? No. Are there 3 peaks? No, 1 peak. And then after cardiotrophin, you can see that the 3 peaks. Now, remember, it's not always perfect. It's not always ideal. But not only is the S1, if you just focus in on this one, is the S1 have 3 peaks, but the second sound is less than the height of the first. And so that is very important to remember. So out of this book, again, out of the book, the clinical, the index of product bulletins, let's see what Dr. Lee said about cardiotrophin. The loss of muscle integrity. And I'm going to let you hear a video today that at the end of this section that you will realize and see how important cardiotrophin is. Cardiotrophin apparently assists the entire muscular system by influencing the nutritional aspect of selective absorption range of the muscle cell membrane. In other words, what he's saying is that when a muscle, in this case, we're talking about the heart, when it degrades, aberrant cells, dead cells, leak into the bloodstream. This is the principle of any protomorphogen, but especially the heart. Why does the heart break down? It shouldn't. It's because these necrotic nuclear cells are leaking. They're dead cells. They're leaking into the bloodstream. Well, they don't belong there. So the body creates an antibody, cleans those up, but then it goes and attacks the host. That's what we see with the aging heart. It is now an autoimmune aging heart. And this is where cardiotrophin removes that burden on that organ to function normally. This selective range includes glucose uptake. So look at the other implications here. All of your type 2 and type 1, but especially type 2 diabetics, they have problems handling glucose. Obviously, the type 1 is another whole conversation because that's where the pancreas has really declined. So I'm not going to get into that today, but these pre-diabetics, these individuals with high A1Cs, if you put them on cardiotrophin, that will help that situation. Because what takes in the glucose? Muscles and the brain, all the cells, but primarily muscles and brains. This selective range includes glucose uptake and is related to the important energy mechanism, ATP. Exercise is the usual activator of this system. So along with cardiotrophin, you've got this very great pearl hidden in this sentence, using exercise, being particularly significant in the case of the diabetic and potential heart rate failure patient. As such, cardiotrophin provides a valuable remedy for these patients, particularly there was such activity would be inadvised or otherwise unobtainable. So, loss of integrity, carbohydrate metabolism, weakness, decompensation. Here are the necrotic cells leaking in. People that are sedentary, people that senior citizens, or people that just don't exercise, circulatory problems due to the lack of muscle tone. So, and these other slides here get into, in more detail, these bullets, what we just discussed. Any type of repair or maintenance. And that's why I say anyone over 50, cardiotrophin, in my book, it's the multivitamin for the cardiovascular system for the rest of your life. Can't do without it. Diabetics, people that are on statins that I'll discuss next month. I'm going to create an hour and a half on cholesterol and the issues with statins and other things and other metabolic weaknesses, such as poor thyroid function. So that's next month. And so, as I said, Mark had called me and said, Joe, do a little experiment and just send it to me. So these are his slides. Run a graph on 3 clients. I don't care which ones. Have them chew up 4 cardiotrophin, run the graph 10 minutes later. And so this individual I tested. Now let's look how their heart is. All right, so it looks like one peak, one peak, one peak, one peak. There might be a second or a split. And look at the high second sound. Okay, that was at 10 to 11. So a little after 11, I had them chew up 4 cardiotrophin. Now, in most of the slides, the 3 peaks are back. You still see a little split there, don't you? But look at the height of the second sound. This is 10 minutes, everyone, 4 cardiotrophin. That's why I'm saying to use it all the time after 50 years old is not a hardship. 4 a day will do it. And also, when you use a supplement for a correction, you also reveal other nutritional needs. And in this case, it's apparent that that splitting is a B1, B4 deficiency. There it is. This person also needs cataplex B core. So there it was. So you could say, well, good. Well, that's one case. Good for you. So here's another one. And this one is 11:38. This was 3 minutes. It might have been a little bit more, but so let's look at this one. Now, the other thing that you want to see and always observe is that the rest periods, the systolic rest period here to here, and the diastolic rest period from here to here should be completely smooth. There should be no aberrant movement or sounds or vibrations. The heart should be asleep, quiet, at peace. Peace, be still, my heart. Yeah, that's correct. If it's not, that is telling you that there is flutter, that there is the electrical current, the innervating current coming into the heart is not at its optimal. And that is, we say, well, Joe, that's a B core deficiency. That's a B1, B4 deficiency. It is. But it also is a reflection that the heart is struggling. It does not have, it's lost its tone. It's lost its ability to rest and relax, work and relax. So you could see, well, pretty good 3 peaks, and second sound is lower. Good, good, good. But look at all of this static. Looks like a vibrating sander in between. So, and you know, this is something that you don't want to see in individuals ongoing, because this indicates atrial fibrillation. This is not a good sign. So about 5 to 10 minutes, somewhere in there, you can see now, look at the rest periods now. They are completely smooth. And there's your 3 peaks, 3 peaks. Look at the consistency that came into this individual's heart. But what it did reveal that Mark indicates here is another nutritional deficiency. You can see I could turn this, I think that's as high as it goes, but you can see that there's a little bit of regurgitation on this side, but look at this side. This is indicative that we looked at last month. If you want to, you can review that hour and a half and get the supplements. But this is cataplex G and soybean lecithin. This indicates, and it's consistent throughout. And the cardiotrophin clearing everything else out revealed this. This is a presystolic murmur. This is a ringing of cholesterol around this valve. This is, and it's beginning to narrow. So there's other complications with this individual that just taking cardiotrophin revealed. Here's another one. And you can see the same pattern here. And this, everyone, if you want to take a minute and just look at this, this person, if it doesn't clear, should go to the hospital. This should be referred out, because this is true AFib. And so, and, you know, of course, I asked this person, well, do you feel your heart? Yeah, you know, I get nervous and I feel my heart. And we talked about that in using E2 or organically bound minerals, which would help this person, or G or Orchex. This gentleman needs them all. And then, but all I gave him, everyone, all I gave him was 4 cardiotrophin. So this was 4:18, not even 10 minutes. And look how it smoothed things out. Again, and look at the S1s, how nice they are. Now, again, revealing that there's cholesterol beginning to form around this valve. So other things are needed. And the second sounds are less than the first. I don't know how, oh yeah, the second sounds were all up, equal to, in most cases, yeah, or greater than. And so simple cardiotrophin, 4 a day. Now, I recommend most people, if they have issues, for a while, they take 6 a day. So, and so I am going to pause the recording because I want to play you something else about that reveals how important, and it makes my point about cardiotrophin. So I have to pause the recording because I can't have this on the lecture on YouTube because they'll reject it because it's copyrighted. So it's very important that we realize what is going on with the heart in the sense that it loses its function because it loses not only the ability, as he said, to twist, to fill, and then become more contracted, and then relax and refill. And so, let me just return to my slides here real quick. Oh, I'm sorry, got the wrong one here. And this is where, as I say, cardiotrophin is the significant product in aging. Doesn't take away from the other nutrients, the minerals and the vitamins, the Bs, the vitamin F and the calcium, which we'll discuss here in the next little bit. But to remove the burden so that the heart does not, the walls of the heart don't lose their tone, because then it can't function. It can't function normally. And so if you look at it in the sense of let me just get to my slide here. If you look at particularly any type of pulmonary issue with the heart, you know that the heart, in, let's say, pulmonary hypertension, let's just take that for a minute. Well, it's the cause of that is because the heart no longer has the tone in the musculature of the organ to contract and move the blood and then relax. That's why it's happening. So medically, I mean, of course, you know, pulmonary hypertension, and it is in my book, is very difficult to, even with nutrition. So what do they, medically, what do they have for this? Well, oxygen therapy, diuretics, and vasodilation, physical exercise. They try to bring the tone back into the heart and to prevent clots, because the heart is not moving the blood is stagnating and it's forming clots. So pulmonary hypertension is huge. And of course, I didn't look it up, but I would imagine that the first product for pulmonary hypertension is cardiotrophin or cataplex B. Not only the electrical tone, but the product, it is going to maintain or return the physical tone of that tissue over time, of course. So what else? What else are the great indicators of heart failure, of loss of normal function for the heart? That is heart leakage, what we call murmurs. Now, when we use the heart sound recorder and we're not diagnosing, we are observing a nutritional deficiency. And here it is. Look, everyone, after the 3 peaks, you can see it looks most of the time like a tooth. There it is, every time. This is indicative that there is leakage in the heart. Now, you can call it a murmur, you can call it anything you want, but the function of the heart becomes inefficient. The full range of blood is not moving out. In the case of the mitral, 100,000 miles, 100,000 times a day, is not doing that. Some of it is going back up into the atria. And that is the loss of electrical current. Electrical innervation, as Dr. Lee said, is of primary importance. Even if the heart muscle that we just went through is toned, even if those 2 spirals are really working in agreement, in alignment with each other, without the electrical current stimulating, you lose the ability of the heart to contract properly and move the blood fully. And over time, the muscle, not only because it's lost its tone from breakdown and assault from the immune system, but it loses its tone over time because of the absence of the accurate electrical current. So here again, I'm going to pause this, and I want to show you another and so you could see from that over time, because of the breakdown, the lack of nutrition, and the breakdown in the valve itself, and you can see the indicator here, that mitral valve prolapse occurs. Now, medically, which is great, they understand and they have acknowledged that mitral valve prolapse is a magnesium deficiency. Here's the article. You can download this and read it. The importance of magnesium status in the pathophysiology of mitral valve prolapses. So there's one nutrient. But we know, and as you can see, and you could see on the video, the normal mitral valve, all the other valves have 3 flaps. The mitral valve has 2. And they must close like that. They must seal up. If they don't, as you saw on the video from Mayo Clinic, one of them, when it's supposed to be sealing, is prolapse. So blood now is leaking back into that upper chamber called the atrium, when it should be being sent out through the aortic valve 100,000 miles out. Now, why is this a problem? Well, if it happens once or twice, but if it's happening 100,000 times a day for decades, the heart doesn't receive oxygen, it doesn't receive nutrients. And so the correction of that is again cardiotrophin, but more importantly is the electrical current. Now, the other I would mention here, since I'm recording this, and I probably won't record anything like this again, look at these strands. You see them? They look like little strings of a musical instrument. Those are tendons. They are attached to these flaps. So if you lose tone as a third piece of this breakdown, if you lose, the tendons lose their tonacity, then they don't close and they don't open properly. Now, most teachers don't teach that, and most aren't aware of it, but I'm telling you that this is very significant. Say you're giving them, you say, Joe, they're on cardiotrophin, they're in catabolic B core, they still have this mitral valve prolapse. Then you have to go and give the proper care to the tendons. And that is in my protocol on ligaments and tendons, on disc issues. The important mineral is manganese, and the gland to help with the full utilization of manganese is the pituitary. So here you have that connection with the endocrine system and with the mineral. And the vitamin, again, is vitamin E. So if you put it together, well, I need the vitamin, mineral, and like protein, there it is. And so what are tendons made of for the like protein? Well, you would probably have to use dermatrophin. So I would have to look that up to see, but I'm sure they're collagen in nature. So that would be dermatrophin. But cardiotrophin would also apply there. So very important. So there's the study. The other piece of this, as far as heart strengthening in minerals, is calcium. Now, there's this battle between medical science, say, oh, you don't want calcium in your heart. You have to have calcium. What they're referring to is you don't want the wrong kind or too much. You want the proper regulation. So this was an article from Saline River Press. You can go read it. This Dr. Podolsky, and what a great article. This was early 1900s. They were injecting calcium into people. High calcium concentrations produced vasodilation, excellent, and increased coronary circulation. Wow. Calcium. It also promotes heart circulation without causing additional strain on the heart by increased aortic pressure. Now, that's what we talked about earlier. As the heart loses its shape, there's a lot of pressure to move the blood by the bottom musculature of the heart. And that's where you can't just give them calcium. You have to give them the cardiotrophin with it, as is associated by adrenaline. So these are the things that that stimulate the brain and stimulate the adrenals to move the heart. But they're missing. He, of course, was not trained by any of us. He's just focusing in on calcium. But they also need the B and the cardiotrophin. Calcium also reduces the pulse of tachycardia by 25 to 50 pulsations a minute. You get tachycardia with somebody with, a heartbeat of 150, calcium brings it right down to 100, which is still high, but better than the other. All symptoms of decompression and myocardial weakness usually disappeared after treatment with calcium. Wow. Myocarditis and subacute and chronic endocarditis with myocardial insufficiency, rapid pulse, dyspepsia, cardiac dilation, enlargement of the heart, enlargement of the liver. So they were doing this experimenting with calcium into the bloodstream, but they also noticed it brought down liver enlargement as well. So if you're not impressed with that, I know you are, but I was very impressed. Here's some of the rest of the article. Calcium exerts a remarkable influence on the patients with congestive heart failure. Yes, because without calcium, remember the muscle tone. It can't have the tone without calcium. It can't have the protection it needs if there's an infection in the heart, because calcium stimulates phagocytosis. It stimulates the white blood cells to go take care of that. Without calcium, there's no stimulation of phagocytosis. There's nobody to call to get it taken care of. Heart rhythm and contractions were also improved, as well as all forms of circulatory weakness, manifesting as general fatigue and high excitability of heart. Calms the heart. We talked about the minerals and the other vasodilating vitamins for the heart, but here is another essential mineral. And calcium stimulates the depressed heart in grip, what I just said. You can't have good immune alertness and function without calcium. And pneumonia. Calcium reduces blood pressure. Best results with calcium therapy and treatments for hypertension during the summer months because of the increased exposure to vitamin D. Listen, everyone, how many people, and I'm going to talk about this big time next month, have all of this vitamin D and no calcium? Remember, D, you could say, well, Joe, no, D takes the calcium from the gut and puts it in the blood. I know. But it holds it in the blood. You don't want it in the blood. You want it in the heart. You want it in your muscles, with enhances calcium absorption. So calcium is antagonistic toward guanidine. So guanidine is a toxin, a factor in paragenesis and increased arterial tension. So there's the relaxation factor. Calcium paves the way for a removal of the tension by neutralizing guanidine. Because guanidine is this poison that brings on pain. Chlorophyll, by the way, just so a side note, neutralizes guanidine. You get a lot of heart pain, take chlorophyll, it will go away, but you got to fix the cause of it. But guanidine, in that poisoning of the tissue, creating that pain and irritating the nerves around in that area, wherever it is, you also, that calcium relaxes, that guanidine creates a lot of tension because it's irritating the nerves. So the calcium helps with that relaxation. So here are all the wonderful attributes of calcium lactate. And it has to be that 5-to-1 ratio. And this is the issue why medical science says, oh, no calcium for the calcium beta blockers. Yeah. Well, it's the right kind. You need an ionized calcium, which is not bound to a protein. That's the problem. And that's why they use the beta blockers, because that creates other problems. Calcium lactate is ionized. It's an ionized calcium. It goes right to the muscle. And it's very easily utilized. And calcium carbonate, the other calciums that cardiovascular doctors and surgeons are concerned about, it's because it has to go through 12 changes. Calcium lactate is one change, one. In order for calcium, though, and here's the other pearl, in order for calcium to be useful in soft tissue, the heart, the muscles, your skin, your hair, your nails, there must be enough F to transport. And that's the problem with taking D without F. Calcium's not going to go anywhere. You have to have the transport substance mechanism, and that comes through essential fatty acids, vitamin F, fish oil, cod liver oil, the F tablets, any oil. But those are the primary ones that we like. One biochemical change. And the balance between calcium and magnesium. Now, you could ask, which some of you I know are thinking, well, what happens if they have that prolapsed, the mitral valve prolapse? Would you give them extra magnesium, or would there be enough in the calcium lactate? You would give them extra. These people need a lot of magnesium. And the simple way you know, well, how much magnesium? It's very simple. You get too much magnesium, your bowels loosen up. That might be good for constipated people. It's a good way to take 2 or 3 of those before bed. So that's the indicator you have too much. And remember, calcium lactate is not a dairy product, so I'm not going to go into that. So if you wanted to test for blood calcium, you could use this test. And you can go to Lowell Keppel's training online, I think through Selena Press, and I think he has a video on how to do the Trousseau test. So the Trousseau test will tell you how to test calcium in the blood, and the tissue calcium test, the calcium, what we've known as the calcium cuff test, helps you to determine how much calcium is getting into the tissue. Remember, if you don't have enough calcium in your calf muscle, you don't have enough calcium in your heart. There's the indicator. Now, how do we know if there's not enough calcium? Usually it is indicated, calcium, with the delivery mechanism of the F, the vitamin F, in any form, is any form of the oils. All oils have that vitamin F, but some have more of it than others. Or the Cataplex F tablets that has all 3 forms of the essential fatty acids, all 3. If in the heart graft, in any valve, you see a missing second sound. Now, even if you see, you could say, well, Joe, well, they've got one here. Yeah, they've got one. You should have 2 peaks here, pretty pronounced. This person has 1 and kind of 2 others. That's a no. You must have 2 peaks. Sometimes you'll see second sounds that has too many peaks. That's also indicative of that calcium F imbalance. But missing second sounds is very important. And here's why. And here is again, thanks to Mark Anderson, he found this wonderful article given by the American Heart Association. The summary, where they explore the cause of diminished second sound that may occur in normotensive patients with poorly performing ventricles. Remember that contraction of the ventricles that is pushing that blood. The amplitude of the S2 was lower in patients with poor ventricular performance. Remember the 2 chambers, but the lower chamber is what the upper one is the atrium, the lower is the ventricle. Poor performance as that heart comes around to the bottom. These observations indicate that if patients with poor ventricular performance Isovolumic relaxation may be compromised. In other words, the heart doesn't finish its contraction. This would cause a reduction of the rate of development of the diastolic pressure gradient, which would result in a diminished S2. So to make this simple, here's Dr. Lee in all simplicity. If we don't have vitamin F and calcium, the contractions of the heart will not be completed. The work cycle, this is my injection here, the work cycle fails before it completes itself. The contraction collapses before the contraction is finished. There it is. The flow of blood has not been stimulated or promoted as it does normally. So when it comes back to close the valve, the contraction is tapered off. Too late. Sorry. I did my job. I moved the blood as best I could, but it wasn't good enough. And the velocity has been reduced so that there is no reaction. It is the reaction of the closing of the valve that makes the second sound. Boom, boom. You must have indication of both sounds. This has one sound. Now the valve is closing, but it is closing before it's so weak that it doesn't even register. Now you could say, well, what is the high second sound? Well, the high second sound is indicative that contraction collapses halfway through and the blood just falls back. You've heard me and seen me in seminars use the example of just falling into a chair. Watch people get into cars. They fall into the car seat. They fall into chairs in their house. No, you should have the muscular tone and electrical innervation throughout your body to sit down graciously, get into a car normally, graciously, not collapse. And that's the blood, the high second sound. So this is where the work, it collapses even before it gets started. Boom, boom. So weak. Didn't even have a chance. As he says, it doesn't even have a chance. And the velocity has been reduced so that there is no reaction, nothing going on. The valve barely closes. So here are the attributes of the Cataplex F tablets. Great source of iodine. And don't believe when people say, well, iodine, that will overstimulate your heart. It's actually not true. Dr. Lee was very clear that iodine could, even a rapid heartbeat, could actually slow it down. You have to try it and see. And that's exactly what he said. So remember that the F is the transport substance mechanism for calcium to the tissues. It's the first thing you learn as a sales rep in standard process. Now, a lot of these new reps haven't learned that yet, but they will. So, and here he is talking about the graph again, but I want to spend time. This is very important, this calcium and F, and we have plenty of time here. In the heart graph, here on the last page, there is no second sound. That is typical F deficiency. Now, F promotes diffusion of calcium to the muscle. You can't hear this enough. Without enough calcium, the muscle contracts and cannot be sustained. Falling into the chair, falling into the car, falling over. This happens with people who are all in most of the time and haven't got stamina. That is the other great indicator and why I put this quote in here. People say, oh, Joe, I start doing something, I just fizzle out. Their heart is fizzling out. You could say, well, all their muscles are, but the heart is fizzling out. So there is definitely, we've looked at now cardiotrophin, the magnesium, We'll talk about the B in a second. And now the calcium and the F. Now we're going to go into really looking at the integrity of the vascular structure, which again is indicated throughout. And I wanted to give this to you. I've read it to the Heart Sound Recording Group, and you should have this on aspirin, because this is the next, really the next important clinical findings using the heart sound recorder, and why you don't have the vascular tone that is sustaining normal heart function. So maybe we didn't put a quote from this. Taking a baby aspirin daily has been a routine for millions of Americans looking to prevent heart attack or stroke. So prevent that plaquing. Aspirin has blood thinning properties that can reduce the likelihood of blood clots forming in the arteries, and of course the blood clots too. But these same properties can also cause ulcers and bleeding in the digestive tract. Now, you get people that already have scurvy. They have bleeding gums. They have all types of colon issues, bleeding in the rectum. They bruise easily. They have the pink toothbrush. You get these individuals, and then they're taking aspirin on top of that. You know pretty much for sure that they can get not only ulcers and bleeding in the digestive tract, but the brain. The task force says it is new recommendations that low-dose daily aspirin to prevent cardiovascular disease has a modest benefit for ages 40 to 59 and aren't at all increased risk of bleeding. It concludes that there is no net benefit. Let me read that again, everyone, because you're probably not, if you're just listening, you're like, Joe read that wrong. It concludes that there is no net benefit of taking aspirin for primary prevention of heart disease in those 60 and older. I rest my case. We've been saying this for years. And so you can look at this article. It's really well done. Oh, geez, sorry. What did I do? Oh, I think I just, okay. So what is the moral of the story here? These substances, and we were just talking at the Colorado Springs Study Group, and we talked a little bit about chelation. Now, chelation is as bad as aspirins. A lot of people do chelation therapy to stop plaquing. But you have to remember, when they chelate, they also tear off. That needs to be dissolved off the arterial wall, not torn off. And chelation not only takes the Band-Aid of the cholesterol and calcium that's building up in the arteries, but it's also, it damages. And so this is where you need the vitamin F factor, and you need with the calcium so it gets absorbed properly. And by the way, I didn't say that before, but the other thing that the vitamin F does is it regulates how much calcium goes into the heart, how much calcium goes into the... Nature has its own regulations that occurs naturally. And so very important, and relates to the products that we need for reestablishing the integrity of the vascular lumen of blood vessel structure. The anti-scurvy supplement. And the reason I tied it in with this part of the lecture is because I had the embarrassing moment of being in front of doctors, and I say, oh, they're missing their second sound. Good. We ran the graph, we're gonna chew up the vitamin F and the sound's gonna come right back. Well, they could be deficient in calcium in their bloodstream. But what happens if they're not? So this was a doctor who's become a great friend of mine over the years. And he got up front and he didn't tell me. And I'm like, oh, geez. And so then I gave him the F. It still didn't work. Luckily, I remembered this. The effect of vitamin P. Remember, this is the rutin. These are the range of bioflavonoids that heals the lining of all blood vessels, all 100,000 miles of primary and secondary blood vessels. The effect of vitamin P, Cyruta Plus, has been officially shown to be partly involved with calcium diffusion. Now, some of you on today never knew that, unless you've been to one of my lectures. It helps distribute that calcium in a balanced way, not overdoing the calcium into the tissue. Vitamins P and F, so Cyruta Plus or Cyruta and F, or any range, even Cataplex C would do it, but this is the full potency of the P factor is Cyruta Plus. P and F seem to be partners. When we get weakened muscular walls and our small blood vessels, this should be vascular walls, and our small blood vessels, they fail to hold back the pressure of the arterial pulse as the pressure is put on them. Therefore, the capillaries are subject to undue pressure, and when you have capillary damage, so that's when you bruise, that's when you bleed. Aspirin's, chelation therapy, all contribute to that. This capillary damage is aggravated by the weakness of the arterioles that normally protect the capillaries from that pressure. In other words, if the circulation in the arteries, the bigger blood vessels, don't function properly, it puts a lot of pressure on the little guys, the capillaries, the smaller ones. And so here it is. And anybody that is having invasive cancer treatment, radiation, they must be on this forever. Because once you've had that, and even chemotherapy does so much tissue damage and to the microcirculation. Anything like leaky gut helps repair and tighten junctions between the villi and the small intestine. All of these, bleeding gums. So you can use other things with it. And of course, as Mark has made famous, this lecture, this article out of Harvard Magazine, Harvard researchers have found that rutin, this is Cyruta Plus from buckwheat, a substance contained in that fruit as well as onions, buckwheat, and tea. But believe me, it says it here anyway, has potent anti-clotting powers that could help prevent heart attack and stroke. This substance, this Cyruta Plus, is known as the anti-stroke vitamin. Researchers discovered rutin's antithrombotic property when they screened at least 5,000 compounds for their ability to block the action of a key protein involved in the formation of vessel-clogging blood clots. When rutin rose to the top of the list It was very surprising. Oh, they were surprised when Dr. Lee talked about it in 1940s. Surprising, and we still don't understand exactly why it is so potent. Well, we do. We understand that if you are malnourished in a substance and you provide that substance, it heals the body. And Dr. Lee talked about this, Dr. Radcliffe from Dr. Lee in 47 and then 2012. The last part of this for the last few minutes is on cataplex B. Now, you have heard me lecture ad nauseum about cataplex B and the B1, B4 factor. And this was a gentleman in Lynn and I, it was actually our first lecture on the heart sound recorder. And he came up to me at the afternoon break after listening all day and said, "Joe, my heart has skipped around my whole life." And I wrote the story out for you, but I just want to tell it to you. And because I had said in the lecture, quoted from Dr. Lee, you shouldn't even know that you have a heart. It should be so quiet and rhythmical in your body. He said, "Joe, mine flops around, like a fish out of water." So I gave him at 3:30 at the break, I think I had him chew up, 3 or 4 cataplex B core, cataplex B at the time. We didn't have B core. And then I said, in an hour at 4:30, take 3 or 4 more, because we didn't have the strength of the B core at that point. And then at the end of the day at 5:30, when we finished, chew up 3 or 4 more, and then come back to me. So I reran the graph at 5:30, 6 o'clock when we got done. And it was amazing, because before I even ran the graph on him, he said, "Joe, this is the first time in years, I can't feel my heart." He said, "Is that bad?" I said, "No, that's good. That's good. You shouldn't feel your heart." And look how it normalized. Look how, the other nutrients he was on. He has the 3 peaks. See right here, nice 3 peaks. He's got a little leakage there, and he doesn't have it really there and there. Now, the other side, you could tell he needs more B vitamins. See that split? And there's a little bit of disruption here. So, but this was only 2 hours. And so a great, anytime, any arrhythmical pattern in the heart, any type of rhythm imbalance, whether you're missing a beat or you have too many, or it's off and on. The heart stops, starts up, and goes too fast. That is all the B1, B4. The other that is indicated here is remember we talked earlier in the hour and a half here, we talked about that the rest periods should be completely at peace, smooth, asleep. If they're not, if you have this pre-AFib or flutter or disturbance, if you're observing disturbance, that's because the electrical current, as I said earlier, is not balanced. It's either too much or it's not enough. And what balances that electrical innervation, how much, the degree to which electricity moves throughout the entire heart and maintains that balance, is that cataplex B. Now, the other product that we already talked about in the first segment of this 2-part lecture is the organically bound minerals, or Orchex, or even this Nevaton. But if you run a graph, or someone runs a graph on you or someone else, and you have this, you should take care of it. because this is the precursor to AFib, and we showed you some bad AFibs. And again, a third, you don't want first, second, and third sound. Should be two sounds, same products. Or the splitting, where the left and right side is not beating at the same time. So I'm not going to go into B Core. Most of you are on it. And it is really, if not the highest selling product in standard process, because it works. And remember, the B Core is so unique because we returned back to Lee's original B formulation. Over the years, all of this stuff got added in, and we took most of it out and brought in just the food components. So if you understand the principle that all the B vitamins must occur together, and the only place is nature, 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 nature. There is not one synthetic in this product. Now, we even at standard process, some of the formulators they couldn't believe it when they first saw this, how it cleared all of these discrepancies in the heart, which we showed them in the heart graph. And so, very important that, again, this is one of your essential products. And I will, if any of you want my newsletter about the B vitamin ranges, B and G, which I went into detail with G, so I'm not going to go through that again in this one. You can email me or text me, and I will send you that newsletter. Unless Lynn is still on and she could find it and put it in the chat box here for you. The last, next to the last here, I'm going to take a few more minutes because I want to finish this today, is we looked at the ratio of the first and second sound in the mitral and tricuspid. But the other two last outstanding findings you're going to see in a lot of people is when you're putting the sensor or the microphone over the semilunar valves or near them, they have a high second sound in the aortic and the pulmonic. So those mean two distinct different things. This is the circulatory finding. This is telling you if the blood is too thick. And this is very important because the blood thickness can cause all kinds of problems. This is indicator, especially if you use the supplements, that most likely they're plaquing, their arteries are plaquing up. If this doesn't go away, they've got narrowing. So that's very important. And so what thickens the blood? Too much calcium and too much fat. And here is where soybean lecithin comes into play. So the primary product for this finding is soybean lecithin. And with older men, or when they have this, you can go more than 3 BID. You can go 4, 5, 6 BID for big men or older men. So this is soybean lecithin is a source of phosphatidylcholine. Phosphorus handles too much of that plaquing and narrowing and too much calcium in the blood that hasn't gotten out of the blood, and choline if there's too much fat, too much carbohydrate. And so you want to prevent that plaquing for sure. Now, what are some of the signs? Well, arteriosclerosis syndromes, irritability, depression, forgetfulness, repetitiveness, all of that. And stiffness in joints in the morning, bursitis, cramps, soreness, myositis, prevention of Alzheimer's, serine, which is in soybean lecithin. Remember, the significance of lecithin is because it makes up large parts of significant organs in the body. The brain, by dry weight, 30%, a third of the brain is lecithin. 2/3 of the liver fat in the liver is lecithin. So if you don't have enough of it, then you get other different types of fatty liver issues. And it's significant, which I'm going to teach next month. I'm going to go into soybean lecithin in great detail next month because it keeps cholesterol in suspension. So it's never sticking on the arteries. It's never building up at all. Now so we'll do more with that next month. The high second sound in the aortic, it might be respiratory. It's rare, but it can, or a kidney, but usually it's weak adrenals. So, oh, sorry, I'm still on the aortic. So yes. So, and the other one, of course, is the third that John always taught us, the high second sound, right? In the aortic can be too much incomplete protein. So we're going to go through that next month as well, because you must have all 22 amino acids to have good thyroid function to prevent cholesterol increase in cholesterol. So you can read through these yourself. Some of this will be a repeat next month. So the high second sound in the pulmonic, as the last piece, is indication of either respiratory, maybe some kidney issues, but mainly the pulmonic indicator is stress. And the main product for that is Drenamin right here. Now, some like desiccated adrenals, some like cataplex C, some like adrenal complex, whichever your product. Now, how do you know if you need it? You apply the nutrition, get them back in 2 weeks. This should normalize. And the Drenamin, to me, is the best because it has not only vitamin C, but vitamin G in it. And of course, the protomorphogen. And it is interesting to think about how many people that the immune system, the adrenal pattern, the stress pattern in people is now an autoimmune condition. It's an autoimmune effect, a downstream effect, a breakdown. And what did McGarrison say? McGarrison said, in relationship to vitamin C deficiency and adrenal function, he pointed out that the first thing that happened to people who ate white flour is that they developed weak adrenals. And without adrenaline, remember, you can't make essential hormones without the hormones produced by the adrenals. Their capillaries started to break. They looked upon scurvy as being aggravated and even caused by this adrenal weakness. That was 1933, he recognized that. So, so this product especially. Now, here's a before and after. I just saw this client at a memorial service yesterday. She's still doing great. So I'm glad. I haven't checked her pulmonic for a while, but she had this high. This one was normal, but all of these others were high. And then I put her on the Drenamin, 6 a day, and they normalized. So that's how you know. And So these other slides I will include in my talk next month because I'm out of time now. And you can read through these where I am teaching, my calendar, other heart sound recording resources, and other things that we've put in at the end here. So thank you all for your patience. I know you all have other things to attend to today. And I look forward to being with you next month, which will be August 17th. And we're going to look at cholesterols and the statin myth. The cholesterol myth, but especially as it relates to statins. So blessings to you all. And I look forward to being with you next week on the Heart Sound Recording webinar next Tuesday at 8 a.m. Mountain Time. Take care, everyone.